Hello, you know what day of the week it is. It is my favorite day. It's Thursday, which means I get to sit with Howard and talk about products. Howard, thanks for chatting with me.
Hi, Pam. Welcome to Thursday.
Thank you. I love it. So, this week I had an interesting thing. Now, I am a kind of a dinosaur in my own right when it comes to some of the things I do. Local anesthesia is one of them. I learned what I learned, how I learned it from Dr. Mort Rosenberg at Tufts, and I kind of just do things the way that I learned them. But you have some tricks to have better anesthesia, better patient experience, and I just want to sit back and hear.
Well, I'm happy to discuss it with you because I think it's something that we can all learn about. And I've coined the term ouchless injection, and I have built my practice to a degree on the fact that people say he gives injections, and you never know he's giving you the injection. And I think that's really good. And you have to understand why I focused on that. And they never talked about this in dental school. No matter you're out much earlier than I'm out earlier than you, but they still aren't talking about it. People don't like the injection pain. That's number one. People don't like the fact that when we give an injection, there's a delay time for uptake. And then when you're doing a block, there's uncertainty. Did I get it? Did I hit it? Sometimes you don't know for 10, 15 minutes. That's a lot of production time out the door. And then so what I started doing was giving two injections, two blocks right away. The second one, I'd sit the patient up and go higher and further back. I got away from that. And then there are some implications to the patient who might be your first time they're visiting you, and you give them an anesthetic injection and you can't get them numb. Well, maybe I should have looked further in the phone book for another dentist. See, now I just dated myself by saying phone book because nobody has a phone book anymore. And then there's always post-injection pain. So I looked at products out there going back a long time. And to me, the guru in anesthesia is Stanley Malamed, who by far is probably the most well-known dentist dealing with dental anesthesia that you can ever hear, and have listened to him countless number of times. And he originally turned me on to the concept of buffering my anesthesia. And buffering anesthesia is been researched. It's researched with lidocaine. Now, I know a lot of our audience, as I do, uses articaine. But what I'm going to say is on label relative to lidocaine. Doesn't mean I didn't cheat and use articaine once in a while, but I can't say that, so I didn't. But we're going to talk about lidocaine and buffering it with 8.4% sodium bicarbonate. The reason we're going to buffer it is because it's going to cross the cell membrane about 6,000 times faster. It's going to get your anesthesia to be purer in its form so that you get a more rapid uptake, and that 10 to 12 to 15 minute block now will occur in about 2 minutes, which is
Wow.
like, oh my God, wow is right. That was my first impression when I heard it. Well, my first impression was, yeah, right. But when I tried it and tried it several times, and I kept getting anesthesia in a quicker period of time and just as profound, yeah, it won me over on that. That said, went from the earlier system that we had from a company called On Pharma. If you remember, Dr. Mick Falco was well known from introducing that. He's out of the Bay Area on the coast. And what Mick showed me was a way he created a system. It looked like an EpiPen, okay, in which you actually withdrew 0.3 milliliters of anesthetic fluid and infused it with the 8.4% sodium bicarb, and then that buffered the anesthetic as you were using it. There were a couple of inherent problems with using that system, in that, number one, the minute you activated your sodium bicarbonate, you had to use it within 24 hours because it sort of lost its fizz, for lack of a better way to describe it. And it's the fizz that caused it to buffer the anesthesia. Those little cartridges were about $55 a pop. So if you had 3 patients that day and you only gave 3 blocks and you used a $55 cartridge on Friday, it was no good to you on Monday or Saturday even. So it was a costly way to do business. And you had to buy this fancy EpiPen, and you still had to provide your own syringe and everything like that. So I guess for whatever reason, another company went after that and developed a system called the Anutra Medical Buffering System. And Anutra, A-N-U-T-R-A, is the same concept of buffering. The concept hasn't changed. What's changed is the delivery method. Now you get a case or a housing. Inside is a tray. There's a bottle of lidocaine, a bottle of sodium bicarbonate, and as you draw your syringe up, you're actually mixing the solution as you go. So now that sodium bicarbonate keeps its fizz, if you will, for 14 days. That's 2 weeks worth of use. And you don't have to use your own syringe. You see, Anutra gives you the syringe, and they give you the anesthetic needles. So it's a total system. And it gives you block anesthesia in about 2 minutes. So the principle, the concept's still the same.
Howard, thank you so much.
We'll see you again next week, Pam. Thanks for having me.